And now we're going to go to John Barilaro, the New South Wales Deputy Premier, who joins us from isolation in Sydney. Thanks for joining us, John. First up, are you disappointed that your own Premier, your own government has been forced to introduce such a dramatic lockdown across Sydney today, something you've resisted very strongly over the past 18 months?
Good evening. No, look, I'm not disappointed. I support the move. There's no question that we've seen over the last few days that this particular variant very infectious, and even though the numbers aren't skyrocketing, they are consistent. And with the data that we're seeing, and in our crisis committee meetings, we're clearly having to make those decisions. And we went from restrictions to stronger restrictions today, especially in those 4 local government areas. And if we do that in one way, you can minimise the impact and get back to normal quickly. And so I think they are appropriate response to what we're facing, and what we are facing is real.
Well, it is a lockdown, and sure, it's not a citywide lockdown that we've seen in other states. It's not a statewide lockdown that we've seen as well. At least you're trying to confine it. But the point here is that you're effectively still running, like the other states, an elimination strategy, aren't you? You're not prepared to put up with any level of transmission of this virus, no matter the fact that most of our vulnerable have been vaccinated.
Well, the truth is that the elimination model's always been there. We probably pay the price for our own success, that people want a zero count each and every day. But have a look at, we've reacted slowly. We've allowed those cases to continue each and every day. Our tolerance levels are higher, but no different to what happened during the Christmas period on the peninsula. We said when we have significant outbreaks, we'll respond hard, fast and local. And on the peninsula, it was a lot easier. You closed a couple of the entry roads and a few bridges, and that was able to contain. This is, those seamless and invisible boundaries in the 4 local government areas, significant part of the city, where we're seeing the spread. And we're seeing this virus touch people in a way that is random, that is infectious in just a fleeting moment. It's a very different variant to what we were dealing with last year. And that's why I believe that the response that we put in place today, hard, local, fast, we can achieve that. We'll be back to normal within the week. And, I accept that. It's no different to me having been classified as a close contact of Adam Marshall, very fleeting moment of interaction. But that means I'm now stuck in isolation for the 14-day period out on the 7th of July. But it's appropriate. And if we don't want statewide lockdown, which would be absolutely destructive to the economy, jobs and confidence, and of course to the health of the community, then this is the appropriate measure.
But the question is really, out of 74 people infected, how many of them are ill? A lot of people are asymptomatic or certainly mild symptoms. And the point is, we know that we've got 70 to 80%, virtually all those people in the country over 70 who want the vaccine have received it. They're the vulnerable people. How long are we going to keep shutting down just to make sure that this infection doesn't spread? We're not dealing in the consequences. We're just dealing in treating every infection as if that is the problem.
Well, that's a good point. And of course, what we want to see is greater take-up of vaccination. And you're right, in relation to the most vulnerable in our community, especially our elderly, we have high numbers of vaccination, but we don't have big numbers of vaccination across the general public. And the reality is that we've always argued that if you want to get back to a level of norm where you don't see reactions of government imposing restrictions, regardless how severe they are, then we need to vaccinate. And, hopefully this is a reminder to many out there that have been resisting vaccination for one reason or another, that the only way forward, the only way governments cannot respond in the way that we have, and that is to put restrictions in place, is that we actually become vaccinated. And I'm talking about the general public, not just the most vulnerable. Because what we're seeing, again, like I said, with this strain, other people are getting infected, or people are getting infected in ways that we've never seen before. And there are a number in hospital now, not a big number, but there are a number in hospital. And that tells you this can strike. So what we're doing is taking some caution, but also taking some small steps so we don't get to a major statewide lockdown, which would be a harder hit on the state.
But the point is, when we know the young and the healthy don't get sick from the virus, don't get ill effects from the virus, why do we have to wait until 90% of the population is vaccinated? Why can't we start to be a little bit more realistic about living with the virus now that we know the vulnerable are protected?
But we have been. If you look at our response this week, in real terms, we could have responded last week when the outbreak in Bondi Junction, all those venues. We could have easily have responded in a way that we have in the past, and that was to announce restrictions quite soon. But we haven't done that. We've allowed it to run its course for about a week and a half. I think it's almost 2 weeks. And what we're seeing is just this consistent number of infections. And if we're not careful, and then it takes one seating event, and we had that example, one party of 30 people, 13 of those that in attendance were infected. So this has had to be the response. But we have learned. We have taken time and we've responded calmly, and we're not panicked. But what we are doing is just making sure that over the next 7 days, and we'll evaluate it again, as a government, as the crisis committee, we'll meet again early next week and we'll evaluate it. And we can make changes either way. But this is appropriate for where we are in the cycle with the information that we are seeing.
Now, just briefly, a lot of governments have made mistakes here. This disease is highly infectious. We had the Ruby Princess debacle in New South Wales last year. The Victorian government ran hotel quarantine in a shambolic fashion. But you must be culpable as a government for this outbreak, given that a limousine driver ferrying around international crews into quarantine and out of quarantine wasn't vaccinated and wasn't even required to wear a mask.
Well, absolutely. And as a member of the crisis committee and a member of the government, I was surprised that wasn't mandatory, that they must be vaccinated and they had to wear a mask. It's not good enough that it was just in the guidelines and vaccination was optional. And again, it's a breach in the system. Yes, look, remembering Sydney International Airport, Sydney itself, the gateway to the world, takes in more return travellers than any other state. So the risk is higher, and therefore our protocols and measures should be stronger. And this just shows there is a flaw in the gap. I think Minister Hazzard has conceded to that and is making changes to the health orders. It just shows you again how vulnerable we can be, where we think everything's perfect. We've got this part is wrong, and we've got to accept that. But like always, to learn from it. I think by putting in place the restrictions we have, we'll minimise the impact and we'll get back to normal quickly.
Well, John, thanks for joining us and good luck in quarantine. It's not much fun, believe me. Lots of interviews, lots of Zoom chats, I think, to keep your sanity. Thanks for joining us.
Thank you very much.